The School of Public Health has been around since the late 40s. It was formed based upon the environmental issues and occupational health issues to a large extent that we certainly are all aware of. We basically feel we have a commitment to public health in southwestern Pennsylvania as well as globally, and this clearly is a public health issue in southwestern Pennsylvania. I'm going to speak in basically beating around the bush. I don't have an answer to the question. I'm basically going to tell you I don't really have the kind of information I would need as someone who's allegedly an expert in this area to tell you what the public health effects are in terms of the usual toxicity of chemicals, kind of thing that we worry about with environmental issues. Dr. Kreisky is going to tell you about some real public health effects on the community. So I'll be much more long-winded and talk about all these different things that are happening as background, but you'll hear about real problems. We'll talk about that. Next slide. So this has been around a long time. I would say that the biggest issue for me about this is that having gone through a career where I worked in public health and environmental protection before there was an EPA, I had thought that we had made some progress. And I must say that this Marcellus Shale issue is as if we haven't learned anything over the past 40 years. We're just rushing ahead blindly, hoping for the best, getting what benefit we can, and there is benefit, and sort of burying the idea that there's also risk and there's also better ways of doing it. So this is the usual progression before we learn to do things. There's something that's potentially harmful. There's, report of adverse health effects. People are saying that they're sick. And they certainly are. There's major public concern. Why are you all here? And gee, we don't have any drill rigs around here. But you are all here because of the public concern. And we just don't get the information we need to be able to say, yeah, the fact that people are concerned is justified based upon the kind of information we need to know. Next slide. Here's something that I think is certain. Again, based upon experience, and this is something that these slides are from, more than a year ago when we first got involved in this. I think there'll be surprises. There always are. This is a complex technological issue. This slide is from before we had earthquakes. There will be more surprises. The technology is rapidly evolving, it's rapidly changing. There are going to be statistically significant disease clusters which people are going to relate to the Marcellus Shale, rightly or wrongly. I mean, think broadly about the number of different communities out there which are going to have drill rigs. Think of the number of potential diseases that we might notice if they were affecting friends and family, and the natural variation. Sometimes they bunch together, sometimes they occur, every so often. Over time, they even out. It's like flipping coins. You might get a run of heads, you might get a run of tails. But now what's going to happen are people are going to say, we're suddenly having kids with autism or people with pancreatic cancer, and it didn't happen until they put that rig up. And what happens then? We had this in New Jersey over and over again. We've had this nationally. We get it just repetitively and repetitively. Media attention, property values go down, litigation. I keep saying on the Pitt campus that the students who are going to, in the long run, make the most money over the next 20 years over this are the students in law school. This is going to happen. There'll be less pollution over time because our industry is really very, very good, very adept at finding ways to spend less money on the chemicals that they buy by recycling and on capturing the chemicals that they release to the community because that's their product that they sell. So that's also going to happen over time. Now, very often it's kicking and dragging and screaming that the industry does it. And in New Jersey, our experience very frequently was that they'd fight something for 8, 10 years. You'd finally force them to do it, and then they say, actually that saves us money. We shouldn't have, that mercury we were dumping in the in Barnegat Bay, that's worth something. We shouldn't have been dumping it because we could have been buying less mercury. Next slide. Are we seeing that in Pennsylvania? Yeah, we're seeing that. This is the cycle we're having. So I'm going to cover some of the challenges we have in meeting these kind of issues. Next slide. First, we're not getting the language in a clear sense. If one wants to be paranoid, one can say that it's intentional that the language is not being very clear. I've set up two, and I don't know how well this can be read, two different sets of language which seem to be contradictory, but actually everything up there is true. So the first one, does hydrofracking cause groundwater contamination? There is no proven incident in which hydrofracking has caused groundwater contamination, and major water contamination has occurred as a result of this unconventional gas drilling activities. How can both be true? They both are true. If you define hydrofracking the way the governor and the way your industry does as being the successful release of chemicals 5,000 foot underground, there's really not much evidence that once it's successfully released 5,000 foot underground, that it's going to make its way to the groundwater levels, which are only a few hundred foot below. Okay? But by the same token, there are many instances that we read about in the paper all the time in which hydrofracking chemicals have turned up in groundwater. Well, they haven't turned up in groundwater because they've come from 5,000 foot below, probably. They've turned up in groundwater because casements have blown, casings have blown, the trucks have run over drums of these chemicals, and they've gotten into groundwater. People are now on bottled water because their groundwater is contaminated. It depends how you define the hydrofracking. What we, the public, care about is if you're going to put a drill rig over there, in the next 20, 30 years, till the time you pull that drill rig away, is my groundwater going to get contaminated? And we don't care how it's contaminated. We don't care whether it comes from 5,000 foot underground or now. But you will find that the research that's now being funded and focused on is almost totally the issue of does it get from 5,000 foot? And as long as industry can say, well, no, there's no proof it does, it's sort of just basically not looking at what the issue is, which is, will groundwater get contaminated? And then there's this wonderful thing about, you'll see it on TV all the time in the advertisements, we have this marvelous new technology which permits us to get natural gas, which will be of great benefit to our country, maybe help us get rid of coal and our problems with coal-fired power plants, and that would be a benefit. But don't worry about it because we've been doing it for 40 years. Well, how can it be brand new technology and something we've done for 40 years? Well, it can. Okay, next slide. Let me explain how that can occur. Here's just sort of a schematic of the geology of natural gas resources. I don't know whether I can extend that far, but basically, here's the old-fashioned, we've got a well, we put a thing straight down and there's a big bubble of gas and we get it out. Now what we're doing, though, is we're going down, say, 5,000 foot. There's this Marcellus Shale, gas-rich shale, there's lots of places in the country. We're bending the pipe, and we're sticking this perhaps 1,000 foot underground. That's incredible technology. Blowing holes in it down here, pulling it out. Well, when technology was developed to use hydrofracking to increase the amount of yield of the gas, it was done at, say, 50,000 gallons of water. Now it's done with 5 million gallons of water. The pressures are enormously higher. It's much deeper. Wow, to say this is the same technology as before, I don't know, it's, industry doesn't like it when I say this, but I really think it's a reasonable analogy. It's like saying that no difference between a firecracker and a hand grenade because they're both explosives. No, the likelihood of something bad happening is real. It needs to be taken care of, and it cannot be saying, oh, well, don't worry, nothing bad happened. We started this 30, 40 years ago. Next slide. The secrecy is a major issue. It feeds right into the community issues that Christ is going to tell you about. How many of you remember about the fact that after the Deepwater Horizon, there was a unprecedented amount of a dispersant that was used? Why are you shaking your head? I've done a lot of work down in the Gulf and talked to an audience like this, and everybody asks them to raise their hand, and I'll say, did it worry you? You live down in the Gulf. Did it worry you the fact that part of this is a proprietary organic sulfonic acid salt? They're not going to tell you what it was. And people raise their hands, and then I usually say, well, okay, I'm not going to ask for a show of hands, but how many of you have ever taken an over-the-counter stool softener, a laxative? Because that's what this turns out to be. It's a very common, everyday used laxative. As a toxicologist, I'm not worried about what that's going to do to humans. We take that, as I say, in 1 million doses a day in this country, probably. I have, you know, what's it going to do to the fish at the Gulf? That's a different issue. Why didn't the company tell us about it? They're not hiding it from other companies. Another company for probably $10 worth of analytical approach can figure out what it is. It's just the secrecy which is built in over and over again and really does scare people. People are also upset because of these things that I just told you about before, of getting these confusing stories. How can you tell me that there's never been a problem when in fact there is a problem? Next slide. So for all of these reasons, there's been problems. The health concerns are there, and I won't bother to go through this, but basically this is an analysis of the Secretary of Energy's Advisory Board that looked at, that had a hearing in Washington, PA. These are people who were opposed. They were given 2 minutes to talk. What were they claiming? And about 2/3 were claiming that they were concerned about their health as the reason they were opposed to drilling. So there is definitely a health concern. Next slide. What's the worries? Well, you know, there's so many different ways to be concerned. We shouldn't forget that the workers are of great concern. This is a very shifting workforce. There are people going in and out of it. Some people are coming from other parts of the country. Dr. Kreisky will tell you about that. There's air pollution, water pollution, soil pollution, the noise. Imagine living next to a compressor that's going just about around the clock. The community safety, all these other issues are per part of the reason that we're worried. Global climate change, if done appropriately, natural gas has less of an impact on global climate when you burn it than does coal. And so to the extent that natural gas can replace coal, global climate change should be avoided to some extent by natural gas. But we're losing a lot of the natural gas during the drilling, and natural gas itself, methane itself, is a global climate forcer. So again, industry should be pushed to make sure that they don't lose this natural gas, because when they do lose it, they're losing their product that they could sell, as well as putting out something that could be harmful to us. Next slide. How much is people really looking at this? Well, we did an analysis. It's, for those of you who are interested in looking these things up, it's in last month's issue of Environmental Health Perspectives, which is probably the country's leading, probably the world's leading environmental journal. We looked at the extent to which public health was part of 3 major commissions that had been asked for advice in 2011 to help with the government give advice. And in each one of these, it's protection of public health as part of the executive order. President Obama, the governor of Maryland, a Democrat, the governor of Pennsylvania, a Republican. So all 3 executive orders are concerned about public health. We analyzed the knowledge base of the 52 people who were members of these 3 commissions. Guess how many had any health background whatsoever?
0.
You got it, 0. I mean, this isn't in New Jersey. We used to have, you know, they put a doc on one of these things, which your mail doc would be put on one of these advisory commissions. The major knowledge that a person had about environmental issues was pretty low. Major attribute of the individual who was chosen was that he was the treasurer of the local Democratic or Republican Party, county party, and so good old Doc so-and-so put him on the commission. Not even that. I mean, it was just basically, there's a lot of hydrogeologists, a lot of good people on here. The environmental groups, Trout Unlimited, Nature Conservancy, groups like that, they're good environmental groups. But not Group Against Smog and Pollution, which is a superb group here in Pittsburgh, American Lung Association, Children's Environmental Health Network, any of the environmental organizations that you would associate with human health issues. What about the health department? The state of Pennsylvania, next slide. The state of Pennsylvania had, this is the committee composition. The government agencies, we've got Department of Environmental Protection, Agriculture, you go down that list, you won't find the Commonwealth's Department of Health. Next slide. When we finally get to Act 13, and we've got an impact fee finally, where does the money go? Well, here's a list of 17 agencies, sub-agencies, and commissions that are going to receive funds from the Pennsylvania Impact Fee. Not the Department of Health. Obviously, our leadership at the state level believes that health is not part of the issue of impact. Our Department of Health, our State Department of Health is a beleaguered agency. It's a good agency, but boy, it's hardly got enough money to run on. There's no way that they're going to take on this Marcellus Shale health issues without getting some additional funding. And so far, what we see is almost, it almost looks as if it's an intentional attempt to basically say we're not going to look at the health issue. We won't give any funding at all. They can't even handle it. Right now, they don't even have an organized registry in which if you called up and said, I think I'm sick for this reason with a health concern from the Marcellus Shale rig that's nearby, in which they could, in an orderly way, do a registry, do the kind of things we expect to do in public health. Next slide. So what are the concerns? Well, you know, this is basically toxicology 101, fade, transport, what's going to happen to these chemicals. I want to focus on the mixtures, though. I'm less concerned about the chemicals that are part of, that the industry puts into their hydrofracking mixture intentionally, than I am about the chemicals that react from the mixture, including the chemicals that come up from below, chemical and physical agents. There's radiation down there, so there's a lot of radon that comes up with this material. There's arsenic, there's brine, there's a variety of bromium and barium. You can make a long list of these compounds. How do they interact with each other? There's, of course, all the organic compounds. There's the methane and all the other compounds related to it. We have wet gas here, so we'll have some benzene and toluene and xylene. How do they all interact together? And the answer is nobody's looking. The U.S. Environmental Protection Agency was given money by Congress in 2010 to look at some of the issues. And as Peggy said, I used to head research and development at EPA. The issues that are being looked at now are simply the hydrogeological ones. They expect to have their first phase finished by 2014. We'll have a little bit of the scenario development, and then maybe they'll take on the toxicological issues. It's 2014, folks. Maybe the President's budget has some funds for the National Institute of Environmental Health Sciences to start looking at some of the toxicological issues in the 2013 budget. If it gets through Congress, there'll at least be a start there. But certainly, health has not been where people have been looking at. Next slide. This is a list of all the fracking agents. I won't go through it, but there's lots of different reasons to put fracking chemicals in there, or hydrofracturing chemicals if you prefer. To put them in there. They do lots of things to help bring up the gas. The list is changing dramatically over time. Act 13 is good in that it provides us information about those chemicals, except maybe for those that are confidential. And that's too long to go through now, but it's still an issue. But clearly, we have lots of different chemicals. What's going to happen over time with these chemicals, how they're going to interact. The chemical industry is selling to the drilling industry. They're saying, hey, I've got a better, something that will increase viscosity of the frac fluid, change that chemical. So we've got continual changes going on because of the fact that we're getting better and better at this. Next slide. So there's drinking water issues. You've got the chemicals themselves, the degradation products. By the way, Act 13, which does provide for a lot of the information which we didn't have before about the hydraulic chemicals, says we don't, notwithstanding anything above, the industry does not have to reveal degradation products. It doesn't have to reveal the naturally occurring compounds. It doesn't have to reveal something that's incidental. That's the word, incidental, to what they intended to use. Well, if you remember pesticides like Agent Orange, dioxin was incidental. They didn't intentionally put dioxin in there. It's just the kind of thing that happens. Well, what's going to be happening here, and why isn't the industry responsible for letting us know about it? Next slide. Act 13 basically says that they're not. Technically enhanced naturally occurring radioactive materials. You work with radioactive stuff. It tends to concentrate in lots of different ways. Again, an issue for this. Next slide. Here are the disclosures that are not required under the new PA law, notwithstanding, and as I said, disclose chemicals that were intentionally added to the simulation fluid, disclose chemicals that occur incidentally or otherwise unintentionally present.
How about mercury and coal? That's not the coal industry doesn't intentionally put mercury into the coal. Next slide. We have air quality issues having to do with what we call point sources versus non-point sources. You may have heard there's an ethylene cracking plant going to go up in Butler County. I'm sorry, Beaver. I apologize. I apologize. That's going to go through a whole permitting process, which includes worrying about ozone non-attainment. Roger, you know all about that. Will that contribute precursors that will lead to more ozone formation? It will have to be permitted because it's a sufficiently large facility. It will also have to go through things that are required by the Emergency Planning Community Right to Know Act, which has to do with letting the firemen and emergency responders know what's in the plant and what problem might happen. Because again, it will exceed the threshold for that. None of the individual Marcellus Shale rigs will do that. So how do we aggregate these thousands of Marcellus Shale rigs? Well, there is a little bit in Act 13 about doing it. It's not clear yet whether that's going to be enough, but that is a major issue for us. Next slide. This shows some of the areas that we have in our state that are not in attainment for various pollutants. I think the ozone one is particularly interesting, and this goes for a multi-state area. If we are going to force ourselves out of attainment with ozone because of just adding some more of the ozone precursors, what you have to do in a state implementation plan to meet the standard is to, very often, is to cut down on your industrial development. That's ironic, isn't it? I mean, the goal here is industrial development, and maybe if we exceed these air pollution standards, it's a maybe, we will basically be forced to do the opposite because of the Marcellus Shale, where some will win, some will lose. Next slide. I wanted to sort of finish to talk about the issue public health. We don't like to talk about accidents. We talk about incidents. Next slide. This is an accident. This is the Marcellus Shale. This is the Deepwater Horizon about to be hit by a comet. That's why I have graduate students. They can figure out how to do these kind of slides. That's an accident. Next slide. This is an incident. This was preventable. Next slide. Here's an example of what you can do by a safety culture. This is a Pittsburgh example. This is Paul O'Neill coming in as president of Alcoa and saying, listen, there should be zero workplace problems. We can engineer to have zero. Well, the major thing he did in my eyes, and we used to train occupational medicine residents, and one of the things we tell them before they go out and look for a job was that when you go to a company, a major question you have to ask the company is what happens to the bonus of a local plant manager if the plant manager has an OSHA violation. And if it doesn't affect that person's bonus, you don't want to work in that company. Well, O'Neill fired him. Okay? He sent out, basically, there's going to be a safety culture, and he drove that down. As you see here, this starts out a little bit above, a little bit better than the average for these kind of industry, and it's down to almost zero. That's not what is happening. Next slide. And this is my last slide. This is Frack Cracker, which is a very valuable source. You can find it on the web. It comes out of University of Pittsburgh now with the Heinz Endowment support. It basically looks at Marcellus Shale violations per well from the Department of Environmental Protection website. Looks at it per company for companies that have at least 10 wells, so it's not the real small companies. And as you'll see, there's 30 some odd companies. If you want to know the name of the company, just look on the website. It's got the name. The name to me isn't important. I think what's most important here is the fact that there's a half a dozen companies which have yet to have, during that period at least, a violation. And then here's another half a dozen or so companies which have more than twice as many violations as they have wells. All of these are operating in Pennsylvania. If we're going to get the benefit out of Marcellus Shale, we must do this in a way that these folks don't work in Pennsylvania. And we need the kind of rigorous oversight, which starts with our folks in Harrisburg having that kind of oversight to make sure that people who are doing it wrong don't imperil us all. Thank you.